Have you ever wondered what would happen if you masturbated but didn't finish? Is it good or bad? Will you hurt yourself? If so, how? And if not, then what happens? And is it healthy? These are all very good questions that can be answered by science, logic, and some common sense. So let's get to it. We're going to first discuss the most likely scenario based on how human biology works. Then we will talk about the possible scenarios. Then we will answer the question based on this discussion. What happens when you masturbate but don't finish? It depends on what you mean by finish. The reason is that there are two ways in which we can finish during masturbation. We can either climax or we can ejaculate. They are different things. Let's start with climax. Climax is a feeling of intense pleasure. It is a mental state as much as a physical one. It involves the release of several hormones such as endorphins and oxytocin. It is similar to the experience of orgasm during sexual intercourse. Some people reach climax easily while others struggle to do so. This is because the brain has to create an elaborate erotic landscape for the experience of climax to occur. Without this landscape, the experience of climax is unlikely to occur. You might be able to tell your brain to produce certain chemicals that increase your desire for sex, but without the rest of the experience, it's unlikely that you will actually reach climax. This is why some people who suffer from sexual dysfunction may still experience climax, even though they cannot ejaculate. And it is also why some people who have spinal cord injuries may still experience orgasms, even though they cannot physically achieve the movement necessary for sexual intercourse. So the first answer to our question is that if you reach climax during masturbation, nothing bad will happen. In fact, many people report feeling relaxed and sleepy after reaching climax during masturbation. However, this is not the only way to finish during masturbation. The other way is to ejaculate. Ejaculation is the release of semen from the body. It is a physiological process that occurs in response to sexual stimulation. During ejaculation, the muscles around the penis contract rapidly, pushing the semen out of the body. Ejaculation is typically accompanied by a release of sexual tension and a feeling of pleasure. Ejaculation requires the release of several hormones, including testosterone and dopamine. These hormones are released in response to sexual stimulation, and they cause a number of physiological changes in the body. For example, the heart rate and breathing both increase during ejaculation. Ejaculation is also accompanied by a number of subjective experiences. For example, some people report feeling pain during ejaculation, while others feel pleasure. Some people also report feeling a loss of control during ejaculation. This is because the body goes into a sort of autopilot mode during ejaculation. The brainstem takes over and the person is unable to stop themselves from ejaculating. This is why some people refer to ejaculation as a reflex. The reason why ejaculation is sometimes painful is that it causes a number of physical changes in the body that can be uncomfortable. For example, the muscles in the pelvic area tense up during ejaculation, and this can cause pain. Additionally, the release of hormones during ejaculation can also cause physical discomfort. For example, testosterone can cause muscle cramps, while dopamine can cause sweating. Finally, the act of releasing semen from the body can also be painful. This is because the urethra can become inflamed during ejaculation, and this can cause burning pain. Now that we know how climax and ejaculation differ, we can return to our original question. What happens if you masturbate but don't finish? If you reach climax but don't ejaculate, then nothing really happens. Your body will simply return to normal after a while. However, if you masturbate to the point of ejaculation but don't actually ejaculate, then several unpleasant things may happen. First, your body will continue to produce hormones that will make you more and more aroused. This could lead to pain and discomfort. Second, the muscles in your pelvic area will tense up, which could cause cramping. Third, the urethra may become inflamed, which could cause a burning sensation. Fourth, you may also experience some level of sexual dysfunction. This is because the body needs to release semen in order to return to a normal state of sexual arousal. When this does not happen, the body can become overloaded with sexual hormones, which can lead to problems with achieving erection or orgasm in the future. Fifth, you may also experience a decrease in libido. This is because the body needs to release sexual tension in order to return to a normal state of sexual arousal. When this does not happen, the body may become less interested in sex in the future. Sixth, you may also experience an increase in aggression. This is because testosterone levels rise during masturbation and may remain high until ejaculation occurs. When this does not happen, the body may become more aggressive than usual. It is important to note that these unpleasant side effects are only likely to occur if you do not ejaculate for a long period of time. If you are able to ejaculate within a few minutes of starting masturbation, then you should not experience any side effects. Additionally, these side effects are also more likely to occur if you engage in vigorous masturbation. If you masturbate gently, then you are less likely to experience any side effects. So, what is the moral of the story? If you want to masturbate, then do so knowing that it's perfectly normal and healthy behavior. Just be aware that you may experience some unpleasant side effects if you do not ejaculate. And if you don't want to masturbate, then don't. There's no right or wrong way to do it. Just be aware that you may experience some sexual dysfunction if you choose to abstain from masturbation. A few things to keep in mind. First, there is a big difference between masturbation and sexual intercourse. Masturbation is a solitary activity that can be done without a partner. Sexual intercourse, on the other hand, is a mutual activity that involves another person. As such, there are some things that are considered taboo in masturbation but are perfectly acceptable in sexual intercourse. For example, it is generally considered inappropriate to use sex toys during sexual intercourse, but it is perfectly fine to use them during masturbation. Also, while it is perfectly normal to orgasm during sexual intercourse, it is generally considered impolite to do so out loud. However, there is no such taboo in masturbation. You can scream, yell, and do whatever you want. No one can hear you unless you live with your parents or roommates, and they re-spying on you, which is a huge violation of privacy and a sign of severe psychological problems. Second, masturbation is a completely normal and healthy part of being human. It is something that everyone does, regardless of their sexual orientation or gender identity. In fact, there is evidence that masturbation dates back to the earliest humans, so don't feel guilty about it. It's what you do when no one is watching, so do whatever you need to do to feel good. Third, there is no right or wrong way to masturbate. Everyone has their own preferences, and that's perfectly fine. Some people prefer to masturbate by stroking their genitals, while others prefer to use sex toys. Some people like to focus on the erotic landscape in their mind, while others focus on physical sensations. Again, there is no right or wrong way to do it. Whatever feels good for you is the right way. Fourth, if you decide to stop masturbating, then it's perfectly fine. Masturbation is a completely voluntary activity, and you can stop whenever you want. However, it's important to be aware that you may experience some withdrawal symptoms. This is because your body will need time to adjust to the lack of sexual stimulation. During this time, you may experience a decrease in libido, an increase in sexual thoughts, and a decrease in overall sexual satisfaction. These symptoms should go away after a few weeks or months, but if they don't, then you should talk to a doctor or a therapist. In conclusion, masturbation is a normal and healthy part of being human. It is something that everyone does at some point in their lives. There is no right or wrong way to masturbate, and you should never feel guilty about it. However, if you choose to masturbate, it is important to be aware that you may experience some unpleasant side effects if you do not ejaculate. These side effects include pain, discomfort, sexual dysfunction, and an increase in aggression. In addition, masturbation is different from sexual intercourse. So there are some things that are considered taboo in masturbation but are perfectly acceptable in sexual intercourse. These things include using sex toys and having sex during sex. Finally, if you decide to stop masturbating, then it's perfectly fine. Masturbation is a completely voluntary activity and you can stop whenever you want. If you enjoyed this video, please leave a like. Thank you for watching and have a great day.